Joining us in the classroom today is the one and only Garant Thumb for another explosive lesson on human anatomy.
We're going to be testing the effectiveness of the .22 pistol from different distances in different scenarios on different parts of the body
in order to understand just how deadly a .22 caliber pistol really is. As per usual, I will match Professor Garant's examples of ballistic trauma with in-depth medical insight.
And as always, we'll be answering questions with what, Charles?
Science.
Science.
Couldn't have said it any better myself. But before we go any further, please note, all depictions of trauma are contextualized within a lesson on human anatomy as per YouTube's community guidelines. So, YouTube reviewer, just chill, bro. Just chill.
So right here we have a Volkorten .22 pistol. It is basically a Ruger Mark IV, a 4.5-inch barrel. Now we have a Liberty Precision suppressor right here,
which makes for quite the teaching tool, if you will. Small though the .22 caliber may be, it has quite the destructive potential in the soft tissues of the human body, particularly because
.22 will enter, it won't exit, but it'll like scramble, sort of scramble your eggs and just, that's not the correct saying at all,
but the imagery is quite effective. Once the bullet has entered the body, it continues to move irregularly and depending on the type of ammunition may fragment or deform, causing widespread damage, far greater than the profile of the entry wound.
It's gonna mess you up, it's not gonna exit. It's just gonna mess everything up inside of you.
Like intrusive thought.
Get this man a PhD. And just because so much of my content creation is done while working at home, I'm excited to talk about something that's definitely a must-have part of my workspace, my new standing desk from FlexiSpot. So before we dive into the video, I want to give a quick shout out to our sponsor FlexiSpot for making this video possible. Without further ado, let's get crack-a-lackin'.
How do you do, fellow kids?
What?
Typically, we use the terms like tumbling or yawing to describe the scrambling movement of a bullet along a wound tract, which will be demonstrated to great effect in Professor Garant's ballistics gel analogs.
For your typical ballistic gelatin, you want about 12 inches of penetration to be a good analog to human tissue.
Hey, yo! We'll need to keep this in mind over the course of our lesson.
These being a little bit thinner, you're gonna see a little bit more over penetration than what you'd see in an actual human body.
Right. If there is over penetration, there is slightly less resistance to the projectile from the ballistics gel. With that being said,
we do have analogs for organs. We do have good bone analogs. The actual course of the projectile is fairly similar and these do pretty well.
And just about as good as close as we can get, short of first-hand experience in a live trauma situation.
We're gonna go ahead and we're gonna start with a further shot in the gut. We're about 30 yards right here. We have 40 grain. Winchester Super X.
Let's make a video.
According to the Winchester website, the 40 grain hollow point has a large diameter metplat, that is to say flat or open tip of nose bullet, than standard .22 ammo, resulting in a greater striking surface that hits hard and initiates an open wound channel on contact. Oh boy. In other words, the bullet is designed to deform or flatten outwards upon impact to create a larger diameter striking surface, transferring more energy into the target. Here we have a clean entry wound in the abdominal cavity, around the level of the belly button at the patient's centerline. The small intestine sustains a direct blow in between the second and third of its three regions. The jejunum, which carries food rapidly along with wave-like muscular contractions, and the ileum, where most of the nutrients from your food are absorbed before emptying into the large intestine. Preceding these is the duodenum, the first region, which begins at the exit of the stomach and curves around the pancreas to end in the region of the left upper part of the abdominal cavity, where it joins the jejunum, leaving it largely out of harm's way.
The reason a gut shot is so bad is obviously you have a lot of bacteria. So if you have any type of perforation into that area, the risk of infection is quite high.
Thank you, Professor. That is exactly right. The small and large intestines both contain food at various stages of digestion. That is, food on its way to becoming stool or feces, plain and simple, later on in the large intestine. Generally, the body does an excellent job at containing this process and the bacteria associated with it within the abdominal portion of the gastrointestinal tract. But, as Professor Thumb mentioned, a single perforation jeopardizes all of that.
So although it is not always a quick death, it is without good medical intervention, certainly a terrible death.
If left untreated, infection is indeed inevitable, with sepsis dealing the fatal blow. This occurs when harmful bacteria from the hole in the abdomen spreads throughout the body, causing a severe inflammatory response that can lead to organ failure, and if not promptly treated, can be fatal. So with bacteria leaking into the peritoneum, the serous membrane that lines the abdominal cavity, it is a race against the clock to disinfect the wound and repair the perforated tissue. The attending physician will perform a laparotomy, begin the cleaning process, and determine the extent of the damage. Generally speaking, because this is usually happening in someone who is not taking the time to consume a bowel prep before being shot in the gut. After the debridement of contaminated tissue, the gut will be repaired and temporarily routed outside of the body through a stoma. That's right, survivors will be getting a bag for going to the washroom.
Right here, the round entered, this is at 30. You can see good perforation. And then what's interesting is that it actually stopped right there on the spine.
It seems that the soft tissues, skin, fat, rectus, and transverse abdominis muscles, and obviously the small intestine, have absorbed enough kinetic energy from the projectile that a firm love tap was all it had left for the lumbar spine.
You can see where it flattened out completely. Are you able to see that through? Death is certainly possible given the .22 pistol. It did not enter and scramble the body though.
Granted, the spine does not take kindly to any blunt force injury. This patient is lucky to have the lumbar vertebrae intact. This may have to do with the fact that the 5 lumbar vertebrae numbered L1 through L5 are typically much larger in size to absorb the stress of lifting and carrying heavy objects.
Lift with your lower back in a jerking, twisting motion.
But do not be fooled. Even from 30 yards, a .22 caliber pistol has the potential to shatter bone.
We had an earlier shot, Aaron shot of mine, that was a little bit high, and that was from 30. You can see right here that it did shatter the rib.
You may be surprised to learn that the true ribs, numbered 1 through 7 from the top down, attach directly to the sternum via their costal cartilage, which provides structural strength and flexibility to the rib cage and protects the internal organs. Since we're dealing with the 4th rib right where it connects to the sternum, in a realistic scenario, this projectile may have destroyed the cartilage, but not the actual bone.
Did not make it too terribly far in. I'm interested to see how it's going to do at closer range. The ribs always are going to present a problem.
But I'd much rather have a broken rib than a .22 caliber projectile embedded somewhere in my lung tissue, as appears to be the case here. A gunshot wound, or GSW, that penetrates lung tissue without exiting the body can lead to a range of serious injuries, including immediate complications like a collapsed lung or pneumothorax, bleeding within the chest, hemothorax, and infection risk, as well as potential long-term issues such as impaired lung function, chronic pain, and increased susceptibility to respiratory infections.
All right, we have 5 yards, 40 grain.
Another fairly central impact. This one looks to have connected at the level of the 3rd rib over top of or very close to the level of the sternum.
So when it hit the rib right there, it actually shattered across, see, like the little lead fragments right there, and it also fractured the sternum.
Those lead fragments, small though they may be, could still cause disproportionately large problems for our patient. I am still concerned about the aforementioned injuries to the lungs, where thin layers of delicate tissue would suffer from a glancing blow from a fragmented projectile. Furthermore, the heart is located between your lungs in the middle of your chest, behind and slightly to the left of your breastbone or the sternum, right where the bullet entered. A projectile powerful enough to fracture the sternum could potentially damage the heart, even if no fragments directly entered the heart. The force of impact and the shockwave generated by the projectile can transmit enough energy through the sternum to cause injuries to the heart, such as contusions, tears in the heart muscle, or disruption of blood vessels. These injuries can be life-threatening and require immediate medical attention. The actual sternal fracture, though this injury is often associated with damage to heart and lungs, is the least of our worries, to be honest, involving conservative treatment, non-operative measures such as pain medication and physical therapy to support the natural healing process.
I'm gonna do a side shot right there, so I'll fire through the sternum. Side shot, because a lot of shots are not dead on. We'll see how it does in that case.
Unfortunately, instead of a trip to the hospital, our patient will not have to contend with more abdominal trauma. Well, at the very least, that's a fractured rib. A point-blank GSW could easily cause severe comminution or fragments of bone at the fracture site and possibly displace the rib to some degree. This injury would more than likely necessitate surgery. Open reduction, that is to say, applying mechanical force to help the bone fragments to realign, and internal fixation, where surgical hardware is used to internally set and stabilize the fracture. In the past, these injuries would be treated non-operatively, but recently there has been a push toward more aggressive treatment of these fractures to expedite recovery and to minimize patient discomfort and disability.
So it hit the rib and shattered immediately.
And now we have bullet fragments penetrating the lower thoracic cavity at the level of the 7th rib. Unfortunately for our patient, the lungs take up a surprising amount of space, extending from the level of the clavicles in front of the chest down to the diaphragm, outwards towards the sides, and relatively far back. Big freaking target with big consequences, as I've already mentioned. Below the lungs, the dome-shaped diaphragm muscle separates the thoracic and abdominal cavities, at the mercy of stray bullet fragments.
If you want to come around here in the back, the larger part of the slug stopped by the PVC stand right here, but likely would have traveled to the spine.
Given the trajectory of the bullet, it appears to have missed the heart, which is a hell of a consolation prize for our patient. The vitalist of vital organs, curiously situated to the left of the thoracic cavity, will live to beat another day. But we're not done yet. Now, when a bullet collides with the spine, even without causing a fracture, the impact of the bullet can damage the spinal cord and cause nerve injuries, soft tissue damage, and vascular harm. These injuries may lead to paralysis, pain, weakness, and long-term complications like chronic pain or sensory issues. Once the patient is stabilized and bleeding is addressed, various forms of imaging, x-rays, CT scans, MRI, as well as neurological assessment would help us to determine how lucky or unlucky our patient really is.
Certainly 22 is lacking a lot of the penetrative qualities that we're seeing from like 9mm.
Yeah.
I think it still has it. I think it's certainly still a killer weapon.
Definitely. I can corroborate this assessment. Many of the injuries we've mentioned, especially those to vital organs, could indeed be fatal.
We're going to be doing a contact shot at the back of the neck.
Something tells me that the spine won't remain so intact in this scenario.
It just sounds gross. I don't like it at all.
The subtle wobble of the ballistics gel following the shot betrays the severity of the damage that I am expecting to see here.
As soon as it hit the spine, it blew apart the spine. You can see right there. You can see how it shredded it.
Well then, blown apart is just about the last way I'd want my cervical spine described. Comprising 7 neck vertebrae, C1 to C7, it provides support for the head and enables a wide range of head movements. Secondly, and more critically in this case, it safeguards the spinal cord, a vital link between the brain and the body, allowing for the transmission of essential nerve signals governing sensory perception, motor coordination, and autonomic functions. Immediate medical intervention, such as mechanical ventilation to support respiration, are really our patient's only hope here.
And then it looks like it exited to the what would be the esophagus. So that seems like a fairly terrible death.
Yes, and given this combination of injuries, suffocation would likely deal the final blow.
Suffocation, no breathing.
Due to the paralysis of the respiratory muscles, our patient could no longer breathe independently, depriving the vital organs of oxygen and causing them to fail. Kind of like when YouTube unsubscribes you from my channel. So I recently revamped my workspace, and the star of the show is my brand new FlexiSpot Comhar Pro Standing Desk Q8. This desk has become a welcome addition to my work routine. As someone who promotes strength, mobility, and wellness, a working surface that accommodates a variety of positions is an absolute must. Personally, this desk has made a huge difference for me because of its size, which is substantially larger than my previous desk. Its movement range, which is substantially greater, and it has way more features that make working on it more efficient for me. Whether sitting, standing, or anywhere in between, the adjustability of this Comhar Pro has got you covered. I'm sure that's why other content creators like Hacksmith Industries and Basically Homeless use these tables in their workspaces. One of the key reasons I chose FlexiSpot is the incredible weight capacity of 440 pounds. With its bamboo work surface and its beefy frame, this table is not only a capable addition to my workspace, but it is also sturdy AF. It's super stable, which is essential for me when I'm working on important tasks and I have all of my stuff piled up on top of it. Plus, it doesn't break the bank. And did I mention the integrated wireless charger for your phone and the USB ports on the control pad? And the FlexiSpot designers really hit it out of the park with the aesthetics of this desk, as it really stands out from other standing desks on the market. But anyway, let's get back to the video. The brain, being highly sensitive to oxygen levels, starts to show dysfunction within minutes. Following closely, the heart's ability to pump blood diminishes rapidly. The lungs can fail next, causing respiratory distress. I could go on, but you get the point.
Oh God.
Chances of survival aren't looking too hot with this one either. Though I have come across numerous stories in the past of people who have survived gunshot wounds to the head. One such article by Dr. M.A. Rothschild and Dr. V. Schneider in the International Journal of Legal Medicine tells of one such story where a 28-year-old man was shot in the back of the head at close range by a robber, who then locked him in a room, assuming that he was dead. The man was discovered alive a full 2 days later and went on to make a miraculous recovery, presenting 3 years later with slight sensory disturbances in the fingers of the left hand and left-sided homonymous hemianopia, a field loss deficit in the same halves of the visual field of each eye.
Oh no. Look. It's way worse than Abe Lincoln.
An entrance wound towards the back, upper left-hand side of the skull, and an exit wound in the right side of the frontal bone above the orbital. The parietal and frontal lobes have definitely sustained damage here. We may consider this instance in contrast to the aforementioned survival story, wherein the entrance wound of the bullet was in the left occipital region and it passed into the periphery of the right temporal lobe where it lodged. As you might expect, survival after a gunshot wound to the head is influenced by factors like the bullet's trajectory, caliber, and the promptness of medical care. The relative importance of different brain regions, including the occipital, temporal, parietal, and frontal lobes, cannot be definitively ranked as more or less important than one another. Instead, each of these lobes serves distinct and critical functions, and their significance depends on the context and the specific cognitive or sensory processes involved.
Oh, he's a unicorn almost.
Yeah, the slug exited the skull and kind of lodged in there. For Abe Lincoln, it actually got trapped in the brain.
The parietal lobe is associated with sensory perception and spatial awareness, and the frontal lobe with decision-making and executive functions. In a miraculous survival scenario, we might expect these faculties to suffer, though outcomes vary widely, as do the cognitive and physical disabilities a survivor might face. Of course, as Professor Guerin alluded to with the mention of Abe Lincoln, a GSW to the head carries a high risk of fatality. Generally speaking, damage to the brain can result in immediate loss of consciousness, paralysis, while the brain's complexity makes it difficult to predict or fully assess the extent of damage. The physical brain tissue is especially susceptible to the shockwave produced by a passing bullet, as well as the permanent and temporary cavities produced by the passing projectile. Unlike some other tissues in the body, brain tissue has limited capacity for self-repair and regeneration, nor is it physically flexible or elastic or especially viable for surgical repair. That is to say, it's fairly challenging to stitch a soft electrified jello back together.
Ready?
As I'll ever be, Professor.
Oh.
A bullet entering the body under the chin will easily pass through the soft tissues of the mouth, as well as the soft palate, nasopharynx, and nasal cavity before it comes to the bottom of the skull. Unfortunately, this region of the skull, also known as the cranial base, where the cranial bones connect, is the most inferior area of the skull. Looks like we're dealing with another bullet on the brain.
So it's not exiting the brain, it's just What's that adage about the 22 just scrambling the brain?
A bullet that does not exit the brain is indeed more likely to move around inside the brain tissue, which, as we've already established, does not provide much resistance to the passing projectile. Neurological issues aside for a moment, the resultant bleeding within the closed skull can increase intracranial pressure, which just means pressure inside the skull. As ICP rises, brain tissue may be compressed, potentially leading to brain herniation, where brain structures are forced downwards through the opening at the base of the skull. But I'm sure in this case, the opening created by the bullet will work just as well.
Right there. And then what you can do is...
Thank you for the excellent demonstration, Charlie. It is indeed true that in some cases when the bullet is close to the surface and may be safely removed without causing further damage to the brain, the attending surgeon will opt to remove it. However, in other cases, leaving the bullet in place may be considered if removal poses a high risk.
So what we're gonna do right here is we're gonna rapid fire into somebody's face.
Whoa, 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 jeez. I mean, what a way to go.
All right.
Even in a rapid fire scenario, these projectiles create subtle wound tracks, allowing the ballistics dummy to retain its shape. But even so, there's no surviving this one. With every impact, the structure of the skull is compromised further, with large cracks forming sometimes farther away from the frontal entry wounds. Though most of the projectiles enter through the frontal bone or orbital socket, they may follow unpredictable paths inside the skull, ultimately affecting different areas of the cranial bone. It should also be noted that the skull has varying bone thickness and density, and as a result, fractures may occur where bone is weaker.
Your skull's pretty thick, by the way.
Additionally, the bullet's impact generates shock waves that can extend to other parts of the skull, leading to fractures away from the entry point. Then, of course, exit wounds, if present, can also cause fractures at their location.
Yeah, that's bad.
And even though our ballistics dummy is still standing, I doubt it can get any worse.
Yeah, I would say dead.
I stand corrected. Everybody, wave goodbye to the heart, lungs, and spinal cord. Now, if you're considering upgrading your workspace, FlexiSpot has got you covered. They offer a wide range of standing desks and ergonomic chairs to meet your needs. And if you're on a budget, check out their E2 model. It's just $150 and provides basic standing functionality. Oh, and don't forget to use my promo code Dr Chris for $30 off orders over $500. Head over to FlexiSpot.com now to explore more options. With the extent of energy imparted to the chest cavity in such a short period of time, if the victim wasn't killed outright by gross cardiac laceration and penetration, they still might die simply from commotio cordis, where a sudden blow to the chest wall over top of the heart causes a cardiac arrhythmia or abnormal heart rhythm that causes the heart to suddenly stop.
And that will clank off the glove of Boyd. I think I got a piece of our home plate umpire. He is in some discomfort. Oh, he has fallen down! And
if that didn't kill him, then the massive pneumothorax or sucking chest wound likely would. When it comes to firearms, even something comparatively small as a silenced .22 caliber pistol has life-threatening implications inside the human body. Humans are a meticulously balanced closed system, and a gunshot wound shatters this delicate equilibrium. Simply put, the body, and especially our vital organs, were never meant to have holes in them. But you already knew that. Thanks again to Professor Garen Thumb and, of course, Charlie, for their assistance in today's lesson. Be sure to follow my online gym, Human 2.0 Fitness, for free right here on YouTube, where we post exercises to help you move better and feel better. If you liked the video, be sure to give it a thumbs up and subscribe to the channel. If you didn't, be sure to let me know why in the comment section down below. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one. Pew pew! A lot of people have asked me questions about the top button of my shirt. And to those people, I just say, whatever.